Gastritis, causes and treatment. Gastritis is an inflammation of the stomach lining that can cause abdominal pain and bloating. Possible causes include bacteria and some autoimmune conditions. Gastritis can come on suddenly, causing noticeable symptoms that may quickly resolve without treatment. Chronic gastritis, however, may go unnoticed. Without treatment, it can also lead to complications over time. Helicobacter pylori bacteria are the most common cause of gastritis worldwide. In other cases, the inflammation is due to irritation, which might result from the use of alcohol or non-steroidal anti-inflammatory drugs, for example. Chronic gastritis is a common problem. In fact, sources estimate that more than 50% of people worldwide have it to some degree. This is an important public health concern as the condition is linked with complications such as stomach ulcers and stomach cancer. This video looks at the symptoms, causes and treatments associated with gastritis and provides tips about what to eat and what to avoid to help ease the symptoms. Symptoms. One person with gastritis may have no noticeable symptoms, while another may have severe symptoms. Typically, people report a sharp stabbing or burning pain in the upper center or upper left abdomen. The pain often radiates to the back. Other common symptoms include bloating and nausea. When gastritis causes vomiting, the vomit may be clear, yellow or green. Some symptoms of severe gastritis include shortness of breath, chest pain, vomit that contains blood, severe stomach pain, foul-smelling bowel movements. A person needs urgent medical attention for any of the following symptoms: a rapid heartbeat, excessive sweating, shortness of breath, abdominal pain with a fever, vomit that contains blood, a large amount of yellow or green vomit, black or bloody stool, dizziness and fainting. Types. Gastritis occurs when the protective lining of the stomach weakens, allowing digestive juices to damage it. This leads to inflammation. Gastritis can be chronic, developing slowly and lasting for a long time, or acute, developing and resolving quickly. The condition can also be erosive and non-erosive. Erosive gastritis is severe and causes the stomach lining to wear down. It may come on suddenly or develop over time. Non-erosive gastritis, on the other hand, causes changes to the stomach lining rather than a gradual breakdown. There are also subtypes. For example, acute stress gastritis is erosive and it develops in response to changes due to critical illness. Causes. Some potential causes of gastritis may include the following: H. pylori bacteria. Most commonly, gastritis is due to H. pylori bacteria. Around 35% of people in the United States have this bacteria in their bodies. Irritating substances. Reactive gastritis, which is caused by irritants, is also relatively common. It affects around 15% of people in the United States. Non-steroidal anti-inflammatory drugs such as ibuprofen and some other common pain relief drugs can cause stomach irritation and gastritis. Non-steroidal anti-inflammatory drugs represent the most common cause of stomach ulcers. Some other irritants that may be responsible for this issue include alcohol and bile. Autoimmune conditions. Autoimmune conditions can lead to gastritis. For example, in people with autoimmune atrophic gastritis, the immune system attacks the stomach lining. Damage to the stomach. Physical trauma or damage to the stomach lining can also lead to gastritis. For example, a person who has undergone surgery to remove part of their stomach may develop post-gastrectomy gastritis, which causes the lining to degenerate. The mechanisms behind this issue are still unclear, but post-gastrectomy gastritis may stem from increased acid reflux, reactions from the vagal nerve, or a radiation in the number of acids triggered by hormones. Other causes. Dietary factors do not usually cause gastritis, but food allergies and celiac disease can contribute to it. Some types of gastritis that stem from other issues include infectious gastritis not caused by H. pylori. Viruses and fungi can cause gastritis in people with immune conditions or other long-term illnesses. Radiation gastritis. When the abdomen has exposure to radiation, it can irritate the stomach lining. Eosinophilic gastritis. This can result from an allergic reaction. Menetrier disease. This is rare. It involves the development of thick folds and cyst on the stomach wall. Risk factors. Some people, including older adults and individuals with compromised immune function, are more likely to develop gastritis. Many health issues and factors such as smoking can also increase the risk of developing this condition. Some risk factors for gastritis include smoking, high levels of stress, excessive use of alcohol or cocaine, swallowing corrosive or foreign objects, a history of chronic vomiting, a vitamin B12 deficiency, routine use of non-steroidal anti-inflammatory drugs, regular use of prescription steroids, chemotherapy, potassium supplements or iron supplements, exposure to radiation either as a treatment option or by contamination, bile reflux after stomach surgery, an autoimmune condition such as Hashimoto's thyroiditis or type 1 diabetes, HIV, Crohn's disease, other infections that can increase the risk of gastritis include tuberculosis and syphilis. H. pylori can spread in many different ways. For example, contaminated food, water or cutlery may play a role. Complications. Chronic gastritis can increase the risk of other gastrointestinal conditions, including stomach ulcers or peptic ulcers and bleeding in the stomach. Certain types of gastritis, including autoimmune atrophic gastritis and H. pylori gastritis, can reduce the body's ability to absorb iron from the blood. Autoimmune atrophic gastritis can also affect vitamin B12 absorption, which can lead to anemia. In addition, having H. pylori gastritis may slightly increase the risk of developing stomach cancer. Treatment. The best approach depends on the cause of the condition and whether it is acute or chronic. Treatment may involve a range of medications including antibiotics, proton pump inhibitors, H2 blockers, antacids, coating agents, anti-nausea medications. Combining the right medications with the recommended dietary changes is the surest way to help relieve gastritis. Home remedies. In addition to making dietary changes and trying the above treatment options, some people may also benefit from natural remedies that they can try at home. This could include using probiotics, supplements, and herbal teas. Some people may also find that techniques to reduce stress, such as meditation and yoga, are useful ways to help ease symptoms. Prevention. Scientists have yet to fully explore the many issues that may cause gastritis. Because some causes remain unknown, it may be impossible to prevent the issue. However, a person can try to reduce their risk by maintaining good hand hygiene and eating well-cooked foods, avoiding medications that can irritate the stomach, avoiding smoking and consuming alcohol.